Did you have snoring earlier?
Yeah, before.
Before it was. Yeah.
Yeah.
When you were snoring earlier, you were getting less oxygen at night and your carbon dioxide was not getting out.
Yeah.
And because of the retained carbon dioxide in the body, your blood pressure goes up.
Goes.
This happens with the sleep apnea patients who are having obstructive sleep apnea because of the wide and thick neck.
The thick neck.
Yeah. So if your carbon dioxide levels are normal now,
Yes.
your blood pressure is normal.
No.
So it's because of weight loss plus because of low CO2 levels. But there are patients who would lose a lot of weight but still they have high blood pressure. They are having essential hypertension. That's a different story. Yours was just because of CO2 retention, because of sleep
obesity,
apnea,
because
of
overweight,
obesity.
that's
So
why.
that's the reason why it's under control, right? You are taking your vitamins.
Yeah, I take one.
That's good. Getting your blood test done every 6 months
Yeah,
or
every
so.
6 months, 3 months.
Fine. That's great. Good.